In 2004, IDEO, the design consultancy that pioneered modern design thinking, was hired by a hospital in the United States to improve the patient experience in its emergency department. The hospital was struggling with patient satisfaction scores. Patients reported feeling anxious, confused, and poorly treated. The hospital assumed the problem was staffing levels or wait times. The IDEO team did something unexpected. Before proposing any solutions, they spent days in the emergency department as patients. Lying on gurneys, looking up at the ceiling, experiencing what patients actually experienced, rather than what administrators assumed they experienced. What they found was not a staffing problem. It was a ceiling problem. Because patients spend most of their time in emergency departments, lying on gurneys looking up. The most dominant feature of their experience was the ceiling tiles and fluorescent lighting. Nobody had ever thought about the ceiling because nobody had ever looked at the department from the patient's perspective. The redesign that followed was not expensive. Better lighting, artwork on the ceilings, screens patients could see from their gurneys that showed where they were in the process, information that reduced uncertainty. The physical environment was changed in ways that cost a fraction of what additional staffing would have cost, and patient satisfaction scores improved dramatically. This story captures the fundamental insight of design thinking. The most powerful design decisions come from deep empathy with the person who will use the solution, not from the assumptions of the people who will build it. Welcome to The Catalyst. This is episode 22. Today, we cover design thinking, where it came from, the 5 stages of the Stanford D School framework, how it has been applied across industries from healthcare to financial services to manufacturing, and how to bring it into your own problem-solving practice. Design thinking as a structured methodology emerged through 2 parallel streams in the 20th century. The academic work of Herbert Simon, whose 1969 book, The Sciences of the Artificial Positioned Design as a Discipline Concerned with Creating Preferred Futures, and the practice of IDEO, the design consultancy founded by David Kelley and Tim Brown in the 1980s, which developed design thinking as a repeatable, teachable process. The framework was formalized and popularized through Stanford University's Hasso-Plattner Institute of Design, commonly known as the D School, which Kelley co-founded in 2004. The D School's 5-stage model became the standard reference framework for design thinking worldwide. The philosophical foundation of design thinking is human-centeredness. The principle that the starting point for any solution is a deep understanding of the people who will use it, and that solutions built on genuine empathy produce outcomes that solutions built on assumptions cannot. IBM, Google, Procter & Gamble, and GE have all embedded design thinking into their innovation processes, precisely because it produces solutions that users actually adopt rather than reject. The Stanford D School framework describes 5 stages of design thinking. It is critical to understand that these are not sequential steps. They are modes of thinking that teams move between iteratively, often returning to earlier stages when new information arrives. Design thinking is not a waterfall process. It is a learning process. Stage 1 is empathize. Before defining the problem, before generating solutions, design thinking requires deep immersion in the world of the person the solution is being built for. This means observation, interviews, and first-hand experience. Not survey data, not customer personas, not market research reports, but direct, qualitative contact with real people in their real context. The IDEO team lying on hospital gurneys was empathizing. Airbnb's early team staying in their users' homes as both guests and hosts to understand the experience they were building was empathizing. The goal is to understand not just what people do, but why they do it and what they feel as they do it. Empathy surfaces insights that no amount of data analysis can generate, because data tells you what happened. Empathy tells you what it meant. Stage 2 is define. The empathy work generates raw insight, observations, stories, friction points, surprises. The define stage synthesizes this material into a clear problem statement, a specific, human-centered articulation of the challenge that the team will work to solve. The classic format is the "how might we" question. How might we make it easier for patients in an emergency department to understand where they are in the treatment process? The define stage is where most organizations short-circuit the design thinking process. They jump to this stage without the empathy work, defining problems based on assumptions or organizational convenience rather than user insight. The result is a brilliantly executed solution to the wrong problem. The "how might we" question forces the team to stay in the user's frame, not the organization's. Stage 3 is ideate. With a clear problem statement, the team generates the widest possible range of potential solutions. Without evaluation, without judgment, without immediately asking whether each idea is feasible. The goal of ideation is divergence. Quantity over quality. The craziest idea in the room is often the seed of the most transformative solution. Google's design sprints, the 5-day structured ideation and prototyping process developed at Google Ventures and used to help portfolio companies solve critical design problems, are essentially a compressed version of the ideate and prototype stages. The deliberate separation of idea generation from idea evaluation is what makes them productive. Judging ideas while they are being generated is the single most reliable way to kill innovation. Stage 4 is prototype. From the ideation work, the team selects the most promising ideas and builds rough, cheap, testable versions of them. The prototype is not the final product. It is the minimum representation of an idea that can be put in front of a real user and generate real feedback. A prototype can be a sketch, a cardboard model, a role play, a wireframe, or a simple digital mock-up. The goal is to make the idea tangible enough to test, not to make it polished enough to launch. Stage 5 is test. The prototype goes in front of real users. The team observes, listens, and asks questions, not to defend the prototype, but to understand what it reveals about the problem and the solution. Testing almost always generates surprises. It reveals assumptions that were wrong, user needs that were not anticipated, and aspects of the prototype that work unexpectedly well. Testing frequently sends teams back to earlier stages, back to empathize when the test reveals a misunderstood need, back to define when the problem statement turns out to be off, back to ideate when the prototype reveals a direction that was not in the original solution space. This iterative loop is not a failure of the process. It is the process working exactly as intended. Design thinking's most powerful organizational applications are in contexts where the problem is complex, the user's needs are poorly understood, and conventional analysis is producing solutions that are technically correct but commercially or practically ineffective. Procter & Gamble's adoption of design thinking in the early 2000s, driven by then CEO A.G. Lafley, transformed how the company approached product development. the insight that emerged from ethnographic research at DESH, deep empathy stage work done by observing families in their homes, led to innovations like the Swiffer, which was built not from laboratory research, but from watching how people actually cleaned their floors and understanding what they found exhausting about the process. In the context of organizational change, design thinking reframes the change process itself as a design challenge, rather than designing a new process and then communicating it to the people who will use it. Design thinking involves the affected people in the design from the empathize stage, understanding their current experience, their frustrations, their workarounds, and their aspirations. The result is a change that people are more likely to adopt because it was built with them, not imposed on them. 5 things to carry from this episode. 1. Design thinking starts with empathy, not ideas. The most common innovation failure is jumping to solutions before understanding the problem deeply. The empathize stage is not a formality. It is the most important investment in the entire process. 2. Define the problem in the user's frame, not the organization's. How might we questions keep the team focused on the user's experience rather than the organization's constraints? The constraint conversation comes later. The empathy conversation comes first. 3. Separate idea generation from idea evaluation. Judging ideas as they emerge kills the divergent thinking that generates breakthrough solutions. Ideate first. Evaluate later. 4. Prototype to learn, not to launch. The purpose of a prototype is to generate feedback, not to demonstrate commitment to an idea. The cheaper and faster the prototype, the more iterations you can afford. 5. Your action. Take a problem you are currently working on, a product issue, a process inefficiency, a team challenge, and spend 1 hour talking to the people who experience it daily. Listen without defending. What you hear will almost certainly change how you have been thinking about the problem. Coming up on episode 23 of The Catalyst. We make the invisible visible. Value stream mapping. The lean manufacturing tool that traces every step in a process from customer order to delivery, identifying exactly where time is being lost, where costs are accumulating, and where the real opportunities for improvement lie. The framework that Toyota built and that has transformed operations in manufacturing, healthcare, software, and professional services. Stay tuned.